Hello, I'm Congressman Adrian Smith, and I appreciate the opportunity to join you today, virtually. I want to thank everyone in the audience for your service and dedication in healthcare during these difficult times and to serving the people of Puerto Rico. Healthcare has always been vital, but especially this year as the world combats COVID-19. We are certainly reminded of this. While Nebraska and Puerto Rico may appear to vary greatly, a common ground between our two homes is the need for health care that best serves the people, especially rural and underserved areas. In Nebraska, especially our 3rd district, we face similar challenges to Puerto Rico when it comes to providing health care to aging populations in our communities. Demographic changes and an aging population create new, different challenges for both health care plans and providers, which require creativity and flexibility, which is why we both see popularity of Medicare Advantage among our seniors. Medicare Advantage is an incredibly successful program that provides opportunities for seniors to receive coverage that better meets their specific needs than traditional Medicare. And not only that, but seniors often pay less out of pocket by utilizing Medicare Advantage programs. In order for older populations to continue receiving the support and access to health care they need, we must ensure Medicare Advantage continues to have the stability and flexibility needed to keep offering affordable options to seniors without putting too much pressure on our healthcare system. As we have learned from experiences with the CARES Act and other COVID relief, we need to account for varying levels of participation in Medicare Advantage when making healthcare policy, especially in times of crisis, so hospitals and communities don't inadvertently receive unequal treatment because of their payer mix. Besides the COVID pandemic, one of the greatest challenges in healthcare policy facing Congress is addressing concerns about drug pricing while continuing to ensure the innovation and incredible potential of our pharmaceutical industry continues to provide us new tools to treat medical conditions and fight disease. I serve on the House Ways and Means Committee, and as the committee works to address drug pricing this Congress, one of the top priorities is the modernization of Medicare Part D, to ensure its continued success for years to come while also keeping premiums affordable for seniors and limiting exposure to extreme out-of-pocket expenses. Programs like Medicare Advantage and Part D have continued to expand in popularity as a result of their overall success and functional access, and we need to work together to make sure residents of both Puerto Rico and Nebraska can rely on them in the future to address their health care needs. Another aspect of this challenge of pursuing health care is reaching the rural and underserved communities within both Nebraska and Puerto Rico. A priority of mine in Congress since well before COVID has been working to expand usage of telehealth services to improve access to care in rural areas. However, COVID has showed us telehealth has incredible potential across the country, not just in those rural areas. As a member of the Ways and Means Committee, I especially recognize the important role safety net healthcare providers play in our communities. The pandemic has shown how valuable telehealth can be in ensuring safety net providers like FQHCs and RHCs can safely connect patients and their providers while eliminating the need to travel long distances. I was pleased to work successfully with my colleagues in Congress last year to ensure the FQHCs and RHCs were able to use telehealth to connect with all their patients, including Medicare patients. Telehealth has proven to be incredibly popular and effective, and I hope to continue working to utilize telehealth to reduce barriers to care in the future. This Congress, we have an opportunity and other opportunities to build on recent telehealth experiences, including the chance to pass my bill, the RUSH Act, to expand the availability of emergency telehealth services in nursing homes and assisted living facilities and reduce unnecessary hospital transports. If we are to succeed in expanding telehealth, we also need to consider the importance of rural broadband and telecommunication access in healthcare. Another goal I would like to work toward. Another similarity between Nebraska and Puerto Rico is the challenge of recruiting and retaining healthcare workers, especially in small towns and underserved communities where educated healthcare professionals are often pulled away by higher salaries in larger cities. While workforce issues in our communities are not by any means limited to the healthcare sector, Adequate staffing of our hospitals and clinics creates the foundation for successful growth and development in all other economic sectors. We need to work together on ways to revitalize our communities and incentivize healthcare workers to return to their hometowns and stay in rural areas after they graduate. Whether it is rural Nebraska or rural Puerto Rico, members of our communities need to be able to depend on access to healthcare. This past year, we were reminded on a global level just how vulnerable we all are in a healthcare crisis. And while it is not always easy, I'm committed to finding solutions amongst these struggles. Once again, I want to thank you all for having me here today, and I appreciate the vital work you do for the health of Puerto Ricans. God bless.